personally worked for an organization. My aunt was actually on hospice services with us. She had been in and out of the hospital several times. My aunt really did not want to go to the hospital. My uncle, who was there caring for her, didn't really understand a lot of the nuances of how hospice worked, and he would panic and he would send her off to the hospital. So in talking to her over several months of back and forth, I really knew she did not want to go to the hospital. So remember one night, the nurse called me about my aunt, and I was trying to help my uncle make sure that he didn't send her off one more time. And the nurse that I was talking with, I said, "Have you used the Macy catheter yet?" What I had already known from the back and forth was that she was getting dehydrated, which was causing her then to get a UTI, which then was having everybody panic, and that's what was causing this back and forth. So it wasn't really a need to be going to the hospital for. They didn't really understand. So she's like, "Oh, right, I forgot, I have that." So she used it. Within 24 hours, she was back talking again. So she'd come out of her lethargy and was actually talking again. And as I remember talking with her, she was amazed within that first hour, the symptoms were already resolving. But we were able to keep her out of the hospital. I think overall, the advice I would give is to approach this with an open mind. This isn't, a lot of people have some reservations, I would say at times, with what this is. We need to get over that fear and uncomfortability, which I think a lot of times lies on the clinician, because they're not sure of how they're supposed to be talking about this, how it actually works, or how the application goes. And it is so simple to use, and it is so it works so well to take care of the patient in a crisis or other situation where it is applicable, that really just have an open mind and adopt this and adapt it into your practice in a way just as you would with anything else we've done from a nursing perspective. We worked very collaboratively with the nursing homes to do education. Every time patients exhibited a certain level of protocol level driven outcome, the Macy catheter would be utilized. Through that small pilot study, we were able to reduce hospitalization rates down to 3.2%. We were able to reduce emergency department utilization to 0%. So the few patients that actually did go to the hospital were warranted. It had nothing to do with the Macy catheter or its failure of the Macy catheter.